Good morning, everyone. Welcome to my primetime webinar, our primetime webinar with SC Thrive. I trust that everyone is having an amazing morning. I don't know about you, but over here in Georgetown, it is raining. It was storming all night, and I was crossing my fingers hoping that, that my lights wouldn't go out. But I'm so excited today for our presentation today. We're going to have Dr. Linda Bell will be with us, our state epidemiologist, and I'm so excited to have Miss Florine Linnen. She is the Diabetes Core Group Director, and she is nationally renowned. She has her group of ladies with her, and we're going to be having some discussions with her. She's going to be helping us to those persons who may have who have diabetes, and maybe you have some questions on how to eat better, exercise, things of that nature. Miss Florine Linnen is the go-to person for this. I hope she has a copy of her book with her. But at any rate, she has been doing amazing things as it relates to diabetes. And so my name is Brenda Blackstock, for those of you who may not know me, and I am the prime advocate for SE Thrive. And for those persons that do not know SE Thrive, we are a nonprofit organization, and our goal is to lead South Carolinians to stability by providing innovative and effective efficient access to quality of life resources. Healthy Connections Prime. Healthy Connections Prime is a health choice for individuals who are 65 and older. If you have Medicaid, full South Carolina Medicaid and Medicare, you can enroll into the Healthy Connections Prime program. The Prime program combines all of the services that an individual, we like to call them the dual eligible individuals, those eligible individuals who have Medicare, the Healthy Connections Medicaid card, and it also combines your prescription drug coverage that you would have under Medicare Part D, all under the Healthy Connections Prime option. When combining all of these cards, this is what you get. You know, I'm oftentimes, I've given this example so many times before. I have ran across so many seniors, one senior in particular who needed some direction and information. She really didn't know what plan she was in. Unfortunately, she was looking at TV, and every time one of those commercials would come across the TV, she would enroll into a plan. And when I looked at her cards, she had like she was enrolled, she had three Part D cards. She had three different plans. Well, the beautiful thing about the Healthy Connections Prime program, that it combines all of these services that you would receive under the Prime umbrella, and you would just have one card to take to the doctors, one card that works at the hospital, one card that you can access even your prescription drug coverage. Just one card. How simple is that? Another feature that I love about the Healthy Connections Prime program is the personalized care team. Again, I can't even say how many times I've even talked about this is very dear to my heart. My father has diabetes, and I wish that he could actually participate in the Prime program simply because of this personalized care team that goes along with the Healthy Connections Prime program. He was inadvertently, he was prescribed from one of his specialists a different medication. And when I saw my father from not seeing him from a couple of months, he had lost so much weight. I was so concerned. I told my mother, I was like, what is going on? Well, what happened was one of his medications that he was taking, that new medication, it caused him to have an adverse reaction that was causing him to lose weight very rapidly. Well, had he been on the Prime program and had this personalized care team, that care coordinator would have picked up on that and would immediately notify, got all the physicians on board, and they would have discovered that that medication could potentially had an adverse reaction. So one of the uh, benefits of having the personalized care team is that this care team consists of all of your providers, including your specialists, and also even your caregiver. Who but the closest person to you is your caregiver, who can really be on top of to notice those changes in your behavior, changes in your health. Maybe that individual could be depressed. Having a personalized care team that consists of your providers, um, any social workers, pharmacists, everybody being on the same team, you can actually uh, have your care personally prescribed to fit you, because not all care is the same. And so, with the personalized care team that's exclusively with the Prime program, an individual, the family caregiver, but most importantly, the beneficiary has a voice in saying what he or she needs and having everybody together coordinating. It's a coordinated effort to make sure that the individual gets the services that they need to be able to heal at home. That's the care coordinator. That care coordinator, he or she is like think of it as the conductor to an orchestra. She makes sure that every person that makes up the care team is a personalized care team. It's a harmony, it's a symphony that flows together. Again, it's a coordinated effort to ensure that the individual who is enrolled in the Healthy Connections Prime program can easily heal at home. One of our scenarios here. What are some suggestions, some things that you think that would help Marie based on her specific situation? Someone says a ramp. Yes, 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 absolutely. I see all the answers coming in. Yes. Durable medical equipment, food, family support, absolutely. Yes, a referral. That's a big one. CLTC referral. Absolutely. Yes. Miss Eve. Absolutely. So that care coordinator would actually develop a personalized plan to help Marie. This is one of the reasons why I say that what I love about the Healthy Connections Prime program, that it is individualized care. It is care that's going to fit the individual. No two persons are alike, and so no care plan can be the same. I have another scenario. This is a different scenario. I just said that no two people are alike and no two problems, even though some people can have the same problems, but the effect of that problem could be different. But in this case, no, this John is suffering. His situation is a little bit different. And so how do you think we can help John? Again, this is a dialogue. Feel free to put your suggestions into the chat. uh, right, addressing the depression. Absolutely. Absolutely, he needs some assistance with his medication management. That's key. In-home caregivers. Oh, I love that one. Connect John to the community health care worker. Absolutely. Yes. Socialization. Absolutely. See that the care coordinator, the team, actually with a joint effort, they all get together to ensure that an individual's, and in this case, Mr. John, that all of his healthcare needs are met. Again, this is paramount when it comes to the Healthy Connections Prime program. Um, I met a woman in the grocery store. We were in Walmart, and she recognized me, and she came up to me. She was like, Miss Blackstock, you're Miss Blackstock. You're the lady that helps people, with the insurance questions and things of that nature. And I said, yes, I'm the Prime advocate. And she was thrusted into this situation where she was going to be the caregiver for her father out of her siblings. She was so overwhelmed. You could see the frustration on her face. But when she pulled that card out, she said, "Let me show you what he has." And it had that Prime on there. I was like, oh. I said to her, "Oh, you have the golden ticket." Oh, I said, everything is going to be okay. I gave her my card. Call me, when you get home, and we can go over this. I said, actually, I am the Prime advocate, and so you can tailor. I kind of gave her a little snapshot while we were standing there. You could just see the relief that just melted away from her. She really was relieved that there was help available. I explained to her the beautiful thing about the Prime program is that you can actually tailor the care to fit the individual's health needs. Miss Eva. And so, in a snapshot, what I'm saying is the same services that an individuals were receiving before, you know, the doctor visits, mental health service. I mean, all of these services that you were receiving before, you still are going to get those same services, and but under the new benefit, all of that equals to one health plan, one health card, one point of contact, no insurance premiums, no copays for doctor visits. You get that care team and a personalized care plan. All of this equals to the individual receiving the right care at the right time in the right place. I'm so excited that just recently, actually during December and January, that Horry County and Dorchester County has just signed on with Healthy Connections Prime. The Healthy Connections Prime program is available across the state, except for there's 2 counties that are currently right now, as of today, they are not yet still participating in the Prime program. And those 2 counties are York and Lancaster. We're going to be, or I'm starting to do some, as we, we're all in the pandemic and we're all trying to do whatever we do safely. Virtuality is the norm now of the day, but in lieu of that, we're trying to safely do some outreach and education in Horry County and Dorchester County. I've got some things lined up for them, for those 2 specific counties, coming up next month. So we're very excited about reaching out in those areas to get the word out and to increase the program visibility in those 2 counties, Horry and Dorchester. You, this is just a testimonial here of a client who enrolled in the Healthy Connections Prime program. Miss Eva, you can please go to the next slide. And so for if there's anyone who's interested in enrolling into the Prime program, if you know any individuals who are 65 and older and have both Medicare and Medicaid as full Healthy Connections Medicaid, we call those individuals the dual eligibles. If you know of anyone, or if you are that person, you are residing in South Carolina and you're 65 and older, and you have both Medicare and Medicaid, you can enroll into the Healthy Connections Prime program. Call our contact center. That number is 800-726-8774. And you can actually say that Brenda Blackstock told me to call and you want to get some more information in regards to the Healthy Connections Prime program, please feel free to call our contact center. You can also go yourself on web, and that's sethrive.org, and you can look on our website, and there's a plethora of information, because not only can we get you into the Prime program, but if you need assistance with SNAP, maybe Medicaid, one of the Medicare savings programs, feel free. There's a plethora of information on our website. Feel free to actually go and look at it. Again, you can call our contact center. That number is 800-726-8774. You can reach out to me. And my number is area code 803. We'll get somebody to put it in the chat. 803-683-1678. Or you can even send me an email, bblackstock@scthrive.org. I'm very excited for the guests that we have today. We're going to ask Dr. Linda Bell. I see that she's signed in to go ahead and get herself prepared for her presentation. We're going to have her to just kind of talk to the seniors, talk to us today about some of, if she has any recent updates on COVID-19. And I know I've been getting a lot of questions in regards to even the vaccines. And so where to go, how we do this, you know, how would they going to roll that out? It's actually um, people are already getting vaccinated. My phone number again, just to make sure that number, my number is area code 803 683 1678. Thank you so very much. And in addition to Dr. Bell, we have today Miss Florine Linnen. I'm excited about having her present with us today. She is the director for the Diabetes Core Group, and this woman is nationally renowned, just like Dr. Bell. She is on the ground. Literally, she literally. This is pre-COVID. Literally would knock on your door and had no problem going to your house and just sitting down with you to provide education on proper eating and what to expect if you were recently diagnosed with diabetes. And this is not something that she heard in the street, but this is from her personal testimony. But we're going to have we're going to have Miss Florine Linnen come after Dr. Bell. And so right now, I'm so excited to have Dr. Bell. If she's ready, we are ready to actually have her come. I wanted to say this too before actually she comes. For all of our panelists, I've got a wonderful, and we do have door prizes today too. I've got this wonderful blanket here. It's our SC Thrive blanket that I'm going to be presenting to our panelists. And now check out these little socks here. They're so comfortable. Oh my God. And they're so soft. Oh. So we're going to give those to our panelists, and also for three, I hate to say luck, but to the three individuals that it depends on when you signed in, to those three blessed individuals, they're going to be receiving my nice little socks in the blanket as well. Dr. Bell, how are you today?
Good morning, Ms. Blackstock. How are you?
I'm doing wonderful. I'm so excited to have you. Thank you so very much to take time out of your busy schedule to actually participate with us today. I know that you're very busy. Everybody is pulling on you. I'm surprised you look as beautiful as you are. I know that everybody is pulling on you. Your name is on just about every platform that I've been on. I hear your name. I'm like, wow, this woman is everywhere. And so we're just so excited to have you today to just um, present in your own way. Just give us some information today.
Well, thank you for the invitation. And I don't
Thank you.
really have a formal presentation. I just will cover some information about the vaccines in general. If you have questions, I guess if you put those in the chat box, I'm happy to address those. But
Okay, great.
I was asked primarily to talk about the vaccines.
Mm-hmm.
And so I will give a brief overview. I'm sure most people are aware that there are actually currently 3 vaccine products that have been given emergency use authorization by the U.S. Food and Drug Administration. And those 3 products are the Pfizer vaccine, the Moderna vaccine, and the call it the Johnson and Johnson. We actually prefer the term the Janssen vaccine. They're all those are the same, Johnson and Johnson and Janssen vaccine. So many of the questions I'm getting have to do with which vaccine is better. So first I'll cover the evidence about the safety and effectiveness of all 3 of those vaccines, because in short, the answer is attempting to shop around to find which product is best for you. Really, there is no choice. There's no reason to try and shop around and pick one vaccine over the other. And this is for the following reasons. So, for example, the Moderna and the Moderna and the Pfizer products are both what we call messenger RNA vaccines. It means that they were developed based on a small amount of genetic material from the virus that causes COVID-19 disease. They do not contain the virus itself. They do not contain live virus. They cannot give you the disease, but they contain a little bit of genetic material that is in the vaccine, and it prompts your body to mount an immune response so that it can recognize the virus itself. Should an individual be exposed, your body's immune system can recognize some protein that's on the coat of the virus and fight against it. That's the way those two vaccines were designed. The Janssen vaccine was designed in a way that it is attached to an inactivated, unrelated virus to the COVID virus. It's just sort of a carrier virus. Also, it cannot give you any disease, but it also stimulates your body to mount an immune response. So the Pfizer and the Moderna vaccines have a demonstrated efficacy in preventing severe disease and hospitalization of about 95% and above in some population groups. And so that's really a very high bar for vaccines in general. When we raise questions about the COVID vaccines, we want to understand that we're looking at the context of all vaccines, all vaccine preventable diseases. So that's a very high efficacy, as, for example, compared to the annual flu vaccine, is on the order of about anywhere from 50 to 70% efficacy in preventing severe disease, not necessarily preventing infection. But you should not attempt to make comparisons between those two vaccines, Pfizer and Moderna, with the Janssen vaccine, because it was tested in a different population group. It was tested at a different point in time when different viruses, variants were circulating in some of those population groups. So the vaccine manufacturers say you can't make head-to-head comparisons. The Janssen vaccine also has high efficacy against severe disease and hospitalization and death. So the point is that they are all excellent choices. And so the vaccine that's best for you is the vaccine that you can get most readily. So just make an appointment. One point about the Pfizer and Moderna vaccines is that they are both offered as a 2-dose regimen. So you have to get 2 doses separated. If you get Moderna by 4 weeks, first to second dose, Pfizer separated by 3 weeks, first to second dose. The benefit of the Janssen vaccine is that you only need a single dose. And so that is a benefit for many people if they have trouble making a second appointment, or if they have transportation issues. So that is a plus for some populations. They're all good at preventing severe disease and illness. Another question that I get is, well, what about the side effects? Are they safe? And all 3 products have been demonstrated to have a very high safety profile. No unexpected events that you wouldn't see with other vaccines. So you might expect within 24 to 48 hours after being vaccinated, soreness at the site of the injection, potentially some achiness, muscle aches, headache, fatigue, low-grade fever is possible. Those are all the result of your body mounting an immune response. That is not considered an adverse event. The only severe adverse event that we're monitoring for all side effects, but the only contraindication to receiving any of those vaccines is a history of a severe allergic reaction known as anaphylaxis to any of the components in those vaccines. So for example, if you get the 2-dose series and you have a severe allergic reaction to the first dose, you should not get a second dose. The other question that I'm getting is, well, what about people who have underlying conditions? Should they be vaccinated? And underlying conditions are those conditions that actually put you at increased risk from complications from the disease itself. Those are not reasons not to be vaccinated. So if you have a history of heart disease, lung disease, even immunosuppression, HIV positive, things like that, you should still be vaccinated because you need to be protected against the complications of COVID. Let's see, other questions that I might get. Well, I can talk a little bit about the vaccination schedule, and not necessarily the schedule, but our rollout here in South Carolina, phase 1B. We just opened that up on March the 8th. And who's eligible now in phase 1B is anyone between the ages of 16 and 64 who have underlying medical conditions, anyone over the age of 64, regardless of underlying medical conditions, just age alone, anybody in the workforce who has an increased risk of being exposed to the virus because of the nature of their work. And so that's who is eligible now to be vaccinated. You can go to the DHEC website if you have access to the internet and know how to use a computer to find. We have hundreds and hundreds and hundreds of providers statewide, primary care providers, independent pharmacies, community health centers, and so forth, where an appointment can be made. You can go to the website and find an appointment, or there's also a number. I need to get that number if you need assistance scheduling an appointment. So Ms. Blackstock, I'll go ahead and stop there in case you have questions. That's just a brief overview of those vaccinations.
Okay, yes, I do have we did have a question to come up in the chat. There's a question, is there a concern with the Janssen vaccine about blood clots? That's a question.
So I'm not specifically familiar with that as an association attributed directly to that vaccine.
Okay.
What I can say is that in terms of the safety of these vaccines, this is safety demonstrated from the clinical trials, but there is an ongoing surveillance system for side effects for the vaccine. If you've had a vaccine, you're asked to enroll in the CDC's Be Safe, which is a monitoring system to look for potential side effects.
Okay.
So Janssen was the one that was most recently rolled out. And so our experience with that one, that is something that I can follow up with you. But
okay.
And so one of the issues is if you have an event that follows a vaccine, that could be an event in timing. That doesn't necessarily mean that it was caused by the vaccine itself. It could be too coincidental. That's something to keep in mind. And so I see there's some other questions coming in the chat.
Yes, yes. So someone just put up a question. Is there a waiting period? Let me make sure I ask that question. She wants to know, do you have to wait 3 months before taking the shot after testing positive, I guess, for COVID? Is there a waiting period?
So you do not from a medical standpoint. I will say that if you've tested positive, that we ask you to wait, and you've had symptoms, you must wait until your symptoms from the disease have resolved. So it's safe to be vaccinated within that time period. The reason we communicated that we were asking people to wait for, we actually asked people to wait for 3 months, was because people who have recently been infected have presumed immunity for about 3 months. And because the vaccine supply was so limited, we wanted people who did not have presumed immunity from natural infection to have the benefit of the vaccine. We're actually in the process of changing that messaging now because it is confusing. There's no medical reason to wait 3 months. That was a vaccine supply issue.
Okay, that was a vaccine supply issue. Okay.
That messaging now and say, if it's been 10 days since you've tested positive, your symptoms have resolved, it's safe for you to be vaccinated. We just wanted to let other people who did not have immunity to get a better chance of being vaccinated.
Okay, I have another question. If an individual takes, let's just say the individual has taken maybe a shingles vaccination or a flu vaccine, should they wait? Could they go ahead and sign up to get the COVID vaccine? Or if you have just recently took in or have been administered another vaccine like the flu or shingles or whatever, should you wait? Is there a waiting period for that?
Yeah, so at this time, we don't have a lot of evidence about the co-administration of the COVID vaccines with other vaccines. Okay. Not necessarily that there could be a problem, but we do at this time ask people to wait about 6 weeks after receiving other inactive vaccines. Now, if they've received certain treatments like a monoclonal antibody treatment or something like that, there could be an interaction that suppresses your immune system. But there can be some individuals who have a need to be vaccinated because of a particular exposure to something. So under a special consideration with your healthcare provider, if they determine that you need another vaccination, you can get that along with the COVID vaccine, but that's not really recommended at this time unless there is a special circumstance.
Okay. Okay.
Just to really to get more evidence about those interactions.
Okay, there's another question. Do we know, let me see. Do we know anything about the schedule or the plan for when the vaccine will be available to the general population?
So our plan at DHEC is that we will probably roll into the next phase, 1C. First of all, if we begin to see the demand better matching the supply, if we begin to see more openings for vaccination appointments. But our plan was that hopefully we would be able to move into phase 1C by May, and that would be opening it up to more of the general population, more workers who do not have a specific increased risk of being exposed in their work site. We call those essential frontline workers who are at increased risk. It could then move into a phase that would offer it to all age groups, regardless of underlying medical conditions. And so we hope to phase this in within the next couple of months as vaccine supply allows.
Okay, all right, thank you. I think there's another one. Let's see. We'll take one more question here. We are looking. Okay, no, that's something else. That's not a question. That was a comment. Well, at any rate, thank you. Thank you, Doctor. Do you wanted to go into, you wanted to say something else? That you had a second part of your presentation? I don't want to.
No, I just wanted to make myself available to answer any
Okay.
questions that you had about the vaccines. To just give a brief overview, we do strongly encourage people to be vaccinated as soon as possible. It's very important for us to get high vaccination coverage as soon as possible so that we can get ahead of this pandemic. We recognize, I hope that people recognize the continued threat of the disease. Even though the disease rates are declining, they've really only declined to a level where we're still seeing several hundred cases per day. And many months ago, we were by that burden of cases. The fact that we've come down from thousands of cases a day doesn't mean it's not still there. So I do want to emphasize that people need to continue the prevention measures, even though we are getting messages that that we are reopening, that masks are no longer required in certain settings. That doesn't mean that masks are no longer needed.
Right.
So while you're getting to get the vaccine, you still must protect yourself against the real threat of COVID. And when people have questions about the benefit of the vaccine, safety of the vaccine, we really want them to weigh those questions about the vaccine.
Yes.
To raise those questions about the threat of the disease and underlying conditions. So please do continue to protect yourself. Take every advantage within your power to prevent your exposure to the virus by maintaining physical distancing, avoiding gatherings, wearing your mask. And actually, I should mention one further thing I did forget to address with those who are vaccinated. Question we're getting now. If you're fully vaccinated, do you still need to continue to wear a mask? And so the CDC came out with new guidelines this past week that if you are fully vaccinated, meaning you've completed the series that's recommended for the product you've received and you're 2 weeks out from that, you're considered fully vaccinated. If you are in a small, like household setting, small number of individuals, and everyone in that group is fully vaccinated, you do not need to wear a mask. If you're fully vaccinated and you're in contact with someone who is at low risk of complications, don't have those underlying conditions, then you do not need to wear a mask. If you are fully vaccinated and you are in contact with someone who does have underlying conditions, maybe at increased risk of complications, you should wear a mask for the reason that the vaccines can protect you against severe illness, but we don't yet have enough evidence to say that the vaccines will eliminate infection. So
Okay.
some individuals can still actually carry the virus. It protects you. You may carry it at a lower level, but you can still spread it to other people. And
Wow.
that's the
Okay.
reason that we must still continue to wear masks in public, even if you're fully vaccinated, until we get high vaccination coverage in the entire population. And so I did want to add that one additional point. And I
Oh,
think
that.
that's for you today.
Okay. Thank you so very much. That was key too. Thank you so very much, Dr. Bell, for everything that you're doing for everyone in your position. And thank you so very much for taking time out of your schedule to present with us today. We really appreciate everything that you're doing. Thank you so very much. And I will get with you so I can get you your gift, your
Thank
fuzzy socks, so you can stay warm.
you. That looks awfully comfortable. Thank you.
Okay.
Thank you for the invitation. Take
Thank
care.
you so very much. Okay. Bye-bye. Now we are so grateful to have Dr. Bell with us. And we thank her again for all of the wonderful information that she shared with us and the questions that she has answered. Well, now we're ready for Miss Florine Linnen. How are you doing today?
I'm quite well. I'm quite well.
Wonderful. I'm so excited to have you here with us today. And I see you've got your team behind you. And we just want you to speak to us about what what is the Diabetes Core Group? What have you guys, what do you do? How can someone benefit from coming in contact with you in your program, a person that has diabetes? What do you have to say about that?
Okay, you want me to say that, or you want one of the team people girls?
Well, right now I want you to talk about the Diabetes Core Group, what it entails, and how does it benefit the people in your community that have diabetes?
Okay, thank you. Can I start from Diabetes Core Group? Is the grassroots organization. It was formed in 1997, and we've worked going on celebrating 23 years. Diabetes Core Group was formed because in the rural community of Georgetown County, there was no information hardly. In the rural areas, people didn't want to come out and share things, but it's different now. And we decided that, we can do this. We organized the group. We started with very few people, teaching them how to take care of themselves with diabetes. Medical University of South Carolina came in and they gave us information to help us out. In fact, they even hired me to work as a community diabetes educator. So there we started. And there we worked teaching people how to live, how you can live with diabetes. For me being a diabetic for, oh Lord, it's so many years I missed my count, but it's about 37 to 38 years. And I have followed my own instruction. Diabetes to me was like a preacher preaching in the church. But when you say to people to do this, then you have to do it yourself. So
Absolutely.
it's a blessing for me to teach diabetes education. And it was a blessing for me that I'm still teaching education. Now, when someone comes into our office, if there is many times they don't have money for medication. And this is where we do that. We educate them and we give them monies when we have it to buy their medication. And we had this wonderful contact with Care Pharmacy. If we didn't have the money at the time, they can take their prescription to Care Pharmacy. Care Pharmacy will fill it for them and then, let us know how much the prescription was. And this was all due to the community. We did fundraisers. We would knock on someone's door if we had to. We take people to Columbia to learn more about diabetes through DHEC project. So Diabetes Core Group to us in this community is community owned. We will do whatever we can to help them, help our community and even other people too. We went to Chicago, Illinois twice to tell that hospital there how we worked in the community and along with the University of South Carolina. We went to Boston to share all the information. And I don't take credit for this myself. I think the community, I think people like Ms. Betty Smalls who are here today, Ms. Brenda Lawrence, Helen Holmes, Mayor Lawrence, and Nazareth AME Church family. Mount Sinai, the entire community have really pushed and supplied us with the needs that we had to get out here and do diabetic teaching. And like I say, for me, it was a blessing. Dr. Bell said about the COVID. I am a person that had COVID. And so I know what COVID can do. I tell people all the time, COVID will bring down the elephant. That's how powerful it is. And I had the underlying diseases. I had the diabetes. I had the high blood pressure. I had the cancer. I had all the underlying diseases. And they gave me 3 months to wait before I take the test. Now, I'm getting ready in a few weeks to work with the medical university again on diabetes and COVID. And it's a risk. Being a community health educator, now it's all volunteer because I retired in 2005, I think. Am I right, y'all? I retired, but I can't stay home, you know. And so I'm still out here getting ready to do some other things. But people have come into my classes and they have had serious problem with diabetes. And believe you me, in a couple of years, some of those people were taken off of medication because they followed the instruction. And let me share this. I went to my doctor yesterday and my doctor cut my medication in half.
Wow.
I was so excited. She says, you take one in the morning, that's it, one needle in the morning. You don't have to take it at night. And it's all because I'm eating right, I'm trying to exercise, and I'm getting good rest. And I'm just happy to know that, and I knew it all along, but you know when you get older, like I am, you just let a lot of that stuff go. But now I'm getting back into it, and it's a blessing. And people that are diabetic, like I saw Joe, take care of you. The diabetes is a disease that places you in the place of a director over your own body. Take care of you and remember you first. You can live a good life with diabetes, and you can also live a horrible life. Because if you don't take care of yourself, and by taking care of yourself, keep up with your doctor. Ask your doctor questions. Sometimes they may get upset, but ask them anyway. Because you want to know about you. And take care of that foot. Yes. So many times people lose their toes, They lose their entire leg because of not taking care of themselves.
Mm.
If you take care of yourself and if you eat right and stop fret so much, because that's what God is here for, to help us out of those situations. Live your life, because life is beautiful. And diabetes, like I say, is hard, and it's a disease that I've seen destroyed so many people. I wrote a story once for the Amira magazine, and it was, I am just tired of wearing black, because in those days, people were just dying from diabetes, amputation.
Mm.
So this journey that I'm on, I intend to stay there. And as long as I can do it to tell people you can live with diabetes. You don't need to die.
Right,
It's all in
right,
your hands.
right, right.
I
So
don't
we
know if I
see.
answered your
So,
question enough.
yes, you did. I mean yes, you did. You know, and we can just see the passion and the love. You know, your desire to really educate people about diabetes, especially in our communities. You know, we can. I mean, it's coming out of your pores. It's coming out of your skin. I see it. I get it. And then for I see you're holding up your
Yes, this
that
is
was
the
your
story
article.
that I wrote, and this was the magazine that printed it.
Yes. Yeah, I love that magazine.
Yeah,
Mhm.
and we also had a lady that came down from I think it was Montana. She came and spent a weekend within the communities, following diabetes around, talking to the people and hearing what they say and see what they were living, how they were living with diabetes.
Yes. Yes.
It was, for me, like I said, it's a journey. It's a journey.
Yes.
Book, and I'd like to show you that other one. Thank you, Brenda.
Oh yes, this is your book. Yes.
This is the one I wrote, From the Cotton Fields to the Capitol. It gives my life story. And when I said from the cotton fields to the Capitol, I'm a member of the South Carolina Legislation Board for Seniors. And there we have a lot, we talk about a lot, you know, we make policies for seniors. And I just enjoy it, you know. And all that came about because of diabetes and working so hard within the area. And when I retired in 2008, I received the Palmetto's Award. And that award is an award that very rarely a citizen of South Carolina receives.
Wow.
And it's because when I look back and see all the hard work, I said, well, thank you, Lord, somebody was noticing that work. And like I say, you know, I'm not a professional person to put it in the way everybody would probably understand, but all I know is to say what I feel.
Right. We got you.
Within my spirit and within my community, I can call people anytime, and they were there. And that's what has made diabetes so great.
Getting the word. Yes.
People.
Yes, getting the word out about education.
Yes.
That's the key. Education is the key. So
Yes.
I noticed, I see your ladies behind you.
Yes, and they got,
and we're going to just give, you know, you can select one of them to just, you know, say in their words what the diabetes core group has meant to them. And then maybe after that, if there's any questions that anybody may have to address to you specifically, we'll allow some time for that. And for all of your panelists, I mean, for all of your ladies that are with you, I want them to know that there's a, you're gonna get a sock. Yeah, I got a sock and a blanket for you too, okay?
okay.
This is Miss Smalls. How are you, Miss Smalls?
Hey, Miss Blackstock, how you doing? Good to
I'm doing wonderful. Just in your words, just kind of tell us, you know, how did the Diabetes Core Group benefit you?
Well, one of the things is that it has been such an educational trip for me.
Mm-hmm.
I've heard about diabetes, but I did not really know the extent that it could infect a person's body. I didn't know all of the ins and outs of people living with diabetes. So it has allowed me to pass information on throughout my family, to pass information on throughout different parts of the state, to help educate other people about what they need to do if they have diabetes, about what they should not do. You know, I never even knew what an A1C was. It just seemed it was some letters to me.
Right.
But I've since learned about it, and I've learned more about what it should be, what a healthy A1C is.
Mm-hmm.
The other thing about the Diabetes Core, as Ms. Florine said, is that it is a community-based program. It's grassroots. It has people working with people. It has people involved who care about people, who want to help, not because they're going to get anything out of it, but because they're going to be able to help people live and live better.
Hey, that's
So
it.
it has truly, truly been an inspirational journey, a very informative journey for me. And the latest that we have here that's sitting behind me are all ladies. And as Ms. Florine said, you know, there used to be a commercial when E.F. Hutton speaks, people listen. Well, when Linnen called, people answer. And that is the absolute truth. She could call on anybody and say, I need or would you? And the next question is going to be, when? When do you need? So she has had a very big impact. She talked about people who started out having received information that, you know, they were on the road to losing a limb. How medication they were taking so much medication. And through the classes that she does in her little office at Chappie, she has classes that she conducts on a weekly basis. And people are coming in and they're learning about themselves. They're learning about what they need to do to improve themselves, to improve their health. And then those folks, they go out and they tell other people about what's happening, about what they can learn. And there's no charge to it. You don't have to worry about, well, how much am I going to pay? Instead of people having to pay, she is there helping other folks. So she's truly, 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 through with her Diabetes Core, been a huge, huge asset, not just the community, but people around the state of South Carolina.
Thank you so very much. So I really thank you guys for tuning in. I want to announce right now, I don't see any questions down in the chat. I just want to say too, because we're coming close to the end here, I want to thank all Miss Linnen, you and your staff. I see Miss Brenda, and I see, I'm not going to call Nick. I can't hardly see through the camera.
Miss Mary Holmes and
Miss Mary. God bless you. God bless you, Miss Holmes. Thank you all for taking time out of your schedule to participate in our primetime webinar. Again, I will get your gifts to you. Every last one of you are going to receive a gift because I really appreciate you participating. And that's what I love about Miss Linnen. When I call her, she always answers. And so I want to thank you so very much. Now I want to ask Miss Eve if you could put up those names I want the 2nd, the 5th, and the 8th person who signed up. We have a gift for those individuals. Now, if they have already checked out, they won't get their gift, but the 2nd is Miss Molly Eunice Bell is the 5th. Okay, and Miss Kim Rawlingson is the 1st. Is the 8th. Who was the 2nd person?
Miss Molly Yothers, Eunice Bell, and Kim Robinson.
Okay, great. Do we have their email addresses? Are they still on the, let me make sure that we will definitely, I will send them an email to get their contact information, to get their, if they can post their email information in the chat. I'm going to need that so we can get your gifts to you. Again, I'm going to give those persons who were the 2nd, 5th, and the 8th individuals. You're going to get our SE Thrive blanket, and it's very nice. I'm not even going to open it all the way because it's huge. It really is huge. And also our SE Thrive footies. They're so comfortable. Oh. And we're going to give them and as well, we're going to give it to our panelists, to you, Miss Linnen, and your staff. So that's 1, 2, 3, 4, 5 for you guys. And then we're going to give one to Dr. Bell and her assistant. So we just want to say again, thank you so very much for tuning in to our primetime webinar. Thank you, Miss Eva Shockey, she's the producer. And I want to say to everyone, you guys have a wonderful day.
Thank you.
Thank you. Bye-bye.
Bye.